So hammer toes can be quite challenging to manage. They typically develop over time as part of a larger problem with a arch collapsing and failing very gradually over time. And as weight shifts over to the lesser toe bones, the toes want to hammer and drift to try and get out of the way from the overload. Many times patients will come in with hammer toe pain. They can have associated what we call metatarsalgia, or pain right at the base of the toe. Really the best options for that are some type of a strap to try to help pull the toe down. You can put silicone toe pads over the knuckle that seems to rub into the top of the shoe, where a lot of patients seem to note their symptoms. But long term, the best way to manage that if you can't control symptoms non-operatively is surgical correction. I do warn patients that doing an isolated hammer toe surgery does have a slightly higher rate of recurrence or deformity, as I believe it's part of a bigger arch collapse. And so if you do not address how the weight is hitting the foot, there is a temporary, slightly greater chance of some residual deformity to the toes. But the surgery can be as minimal as trying to take a knuckle out and fusing that knuckle, which is a small incision, very small surgery, all the way up to balancing the weight on the foot with a partial fusion to the midfoot and potentially shortening some bones that are a little bit long. But it just kind of depends on the severity of the pain and the severity of the deformity. But ideally, simple hammer toe strap or some cushions and shoe modifications could control symptoms, and we recommend leaving it alone if it does.